Hello, I'm Paul Simon. 24 years ago, pediatrician Irwin Redlener and I created the Children's Health Fund, a program that provides health care to low-income children around the United States. We know that the Joint Select Committee has responsibility for helping to bring the country's budget under control in one of the most daunting economic crises of our times. And we understand there will need to be sacrifices. But we want to remind you that children and families are suffering, and we implore you to remember this as you make decisions and recommendations.
Over the years, we've cared for hundreds of thousands of children who would otherwise have not had access to medical care at all. Many of these kids are covered by Medicaid, and many by CHIP, but many more have no coverage at all.
The vast majority of the kids that I see in Arizona are eligible for the Medicaid program. 100,000 kids in Arizona are now on the waiting list for the CHIP program. When you start to cut the funds for Medicaid and CHIP, you see children suffer. You see children going without vaccine coverage, not getting treated for chronic medical problems. Some children will have problems that land them in the hospital or in the emergency room, and some children are going to do poorer in school because of it, and then we will all pay as a society because we decided to cut services to children.
Touch the sound.
Many of the children that I see are on Medicaid and CHIP, and they come from working families where the parents are struggling to make ends meet. In West Virginia, 45% of children depend on Medicaid and CHIP. I know that legislators have many tough decisions to make, but I challenge them to put themselves in the place of the millions of hardworking families, realize that the decisions that they make affect real people.
60% of the kids in Texas either are uninsured or are covered by Medicaid, CHIP, or SSI. Cuts to that will just overwhelm our medical system with children who present to us in crisis. It could be a disaster.
I've encountered many children and families who've benefited from having Medicaid or CHIP coverage. Children are our most valuable resources in this country. Cutting access to insurance, cutting access to preventative care is pretty much divesting in the future of this country.
I would invite members of Congress to please come out and visit one of our clinics in Detroit. See firsthand that for many there really isn't much left to sacrifice.
Medicaid and the Child Health Insurance Program are the two most important safety net programs for children. These must be preserved no matter what else changes in our country.
America's children are sacrificing and suffering enough. Please preserve their safety net programs. Thank you.